Hello, my name is Dan Barber and this is my Anatomy Assignment 3. Now I'm going to talk about the respiratory system and describe how the structure of the respiratory system helps the function. I'm now going to talk about the nasal cavity, and this is it starts at the nostrils, where it has sweat glands, hairs and even mucus, which is able to pick up the dust and any other foreign bodies from entering into your lungs. These have three bones: the superior concha, the middle concha and the inferior concha. The anterior region is made up of a hyaline cartilage, whereas the posterior region is made up of ethmoid bones. The nasal cavity has a high capillary density, so that as the air comes in, it is able to warm up the air as it goes through to at least 1 degree of your body temperature. As you see here, like I said, there's three bones: the superior concha, the middle concha and the inferior concha. As the air comes up in, the air comes round here, which is where the sweat glands are, so it'd heat up the air as it's passing through, and then it moves on to the next part, which is the pharynx. The pharynx has three different walls. They are called the nasopharynx, the oropharynx and the laryngopharynx. These walls are covered in mucus, so they won't be able to come dry, and it is another form of defense to prevent the dust from getting into your lungs. It's a soft collapsible tube which is made up of a soft muscle tissue, which has two holes which allow food to go down one, air to go down the other. This is mainly made up of soft tissue, so that as you're eating and you swallow, it will help to push the food down your throat by a bunch of muscle contractions. As you can see, the green area shows the nasopharynx, the yellow the oropharynx, and the blue the laryngopharynx. And then you got the two holes which allow your air to go in and your food to go down. The epiglottis is a highly elastic fibrous tissue where the taste buds are located. This is a muscle, so it opens and closes the windpipe, which helps prevent the food and drinks from going down into the windpipe and blocking it up. There's two surfaces to the epiglottis. One's the lingual and one's the laryngeal. The lingual surface is facing the oral cavity, and the laryngeal faces the larynx. As it shows here, this is when the windpipe has been closed up, and as you can see here, it's different. It's still open. So this would be when you're breathing, and that's be when you're swallowing. This is an involuntary muscle contraction. You can't help doing it, but it's a survival thing, so it would help you from choking. The larynx controls the amount of air which passes through the voice box. This consists of cartilage which helps protect that voice box. The voice box is located in the larynx, which consists of vocal cords. As the air blows through them, they create a noise, which is how we speak. As you can see here, you've got the cartilage, where the voice box would be located. As you see over here, you got the cords. As the air blows through them, they would make the noise. The trachea is how the air gets from the mouth and the nostrils to the lung. It is composed with 16 to 20 C-shaped rings, which depend on how old you are, which is made up of cartilage and ligaments. So it would help prevent the trachea to cave on itself, which would stop you from breathing. As you can see here, you've got the larynx, and then you come down. The air would come down into the trachea. As you can see here, these are the C-shaped cartilage that I was talking about. This is what gives it the structure and the pipe shape, and as I said earlier, it helps to stop the trachea from caving in on itself. Once the air passes through the trachea, it goes into bronchi and then into bronchioles. This is how the air is passed through your body into the alveoli, where gaseous exchange happens. These start off at 1 millimeter thick, and then as further down into the bronchioles they go into 0.5 millimeters thick, which would then lead on to the alveoli. As you can see here, this would be the trachea here, and then it leads on to the bronchi. So you can see the C-shaped rings are carrying on through it to help it prevent from caving in. And then as you go down further, it leads into bronchioles. These bronchioles are what connects the alveoli to your nostrils, and the alveoli are there to help exchange the carbon dioxide with oxygen. The alveoli is 1 cell thick, and it has a scrunched up look to it. This helps it have a bigger surface area of which the capillaries can surround and help aid the gaseous exchange. Over a duration of training, your body would help produce more alveoli. This would help gaseous exchange become more efficient, and it would be able to change the carbon dioxide with the oxygen, and get the oxygen around your body to the working muscles faster than it normally would. The alveoli are covered in mucus as a last form of defense to stop the dust and other foreign bodies from getting into your bloodstream and being pumped around your body. As it shows here, this is the alveoli. You can, if you struggle thinking what it looks like, you can just think about a cauliflower, as it has one main branch, which would be the trachea, branches off into smaller little ones, which are the bronchis and bronchioles, and then the end bit, the scrunched up looking bits, would be the alveoli. And as you can see, you've got the capillaries which cover the alveoli. This is where the gaseous exchange occurs. Oxygen would go from your nasal cavity into your nasal cavity, where the air is warmed to 1 degree. It passes down your pharynx and to your larynx, where if you're eating, the epiglottis would cover up the breathing hole, but in this case it just followed down through your voice box, which if you try to talk, it would help to make the noise. Then pass down your trachea into your bronchi, which branches off into bronchioles and into the alveoli, where gaseous exchange happens. And then the capillaries take the oxygen down into the muscles, and it happens again, so that the carbon dioxide would then be brought up, swapped into the alveoli, and taken the same way out. The diaphragm here would help push the air out, as well as the intercostal muscles, helping to squeeze the bottom of your lungs and forcing the air out either through your mouth or through your nose. Mo Farah, the double Olympic gold medalist, would have a really good respiratory system. His intercostal muscles would be really pliable, which would help him breathe his ribs move. He'll have a really strong diaphragm. Inside in his lungs, he'd have plenty of alveoli to aid gaseous exchange over the race, and that would happen over long-term lot of training for his race. His thoracic cavity would be bigger, so that he is able to bring in more of the air and help push the oxygen around to the body, to his legs, which he is needing it the most for his race. And now I'm going to talk about the cardiovascular system. This is a picture of arteries, veins and capillaries. This shows that vein has a much smaller wall, so the tunica intima, the tunica intermedia and the tunica adventita, and the artery has a much thicker one due to the amount of pressure having to be placed on the artery to get it around the body, whereas and then the capillaries are made up of different little cells, so that the oxygen and carbon dioxide can go in and out of the capillary. The arteries are the first place the blood goes from when it comes out of the heart. It takes the oxygenated blood away from the heart. This has thicker walls and thinner lumens because there is more pressure and force which are being placed on those walls to be able to send it around the body and into the working muscles. This then branches off into arterioles, and they have a smaller diameter, so they can keep up the blood pressure as it goes into the capillaries. Arterioles have slightly thinner walls, meaning that there's less pressure being placed on them, and that as it branches off into the capillaries. This is where gaseous exchange happens. This can either happen in muscles or even in the alveoli. This vessel is only 1 cell thick, and this is where the arterioles then go into the venules, this is where the blood turns from oxygenated blood into non-oxygenated blood. The capillaries are 1 cell thick, so that it can diffuse through the walls and the gaps in between the cells of the walls. The veins bring the oxygenated blood back up into the heart on the right side of the heart, where it can be reoxygenated and sent back round through the circuit again. The venules are where the blood goes after the capillaries once it's been deoxygenated. These have wider lumen than capillaries and arteries. That's because there isn't much pressure being exerted on the walls, so as it has to fight against the gravity to be able to come back up to the heart. Veins and venules have valves which allow the blood to seep into and sit there for the next shunt of blood to push it forwards, and this would help prevent backflow of the blood. As you can see here, this shows the valves. Once the set of blood goes up, then the valves here would close, so the blood would seep and sit in behind it. Next bit of blood comes up, that pushes the blood through, and it goes like that all the way through the veins. And this is a diagram of an artery wall and how thick. This shows how the thick tunica externa, and then shows how small the inside of the lumen is. So when the blood gets transported around the body, and I'm going to start it off as just coming out the heart. It's been oxygenated, and it would come down through the artery, either branch off to the brain or the working muscles. So once it gets to the muscles, like here, it would have gaseous exchange, and the muscle would use the oxygen and give carbon dioxide back as a waste product, which would be in the veins. As you go up, there will be the valves, which would help with preventing backflow, and the vascular shunt mechanism would work there to bring the blood back up into your body, and then it'll go around, then it'll come back through your heart and to your lungs, where it'd get oxygenated and come back round in a loop, and it would keep on doing that. And it would even help go to the organs. Gaseous exchange is the diffusion of carbon dioxide and oxygen. Diffusion is where something goes from a high concentration area into a lower concentration area whilst passing through a semi-permeable membrane. The gaseous exchange happens in the alveoli, and the oxygen diffuses into the capillaries, and the carbon dioxide diffuses from the capillaries into the alveoli and back out through the trachea and through your mouth or your nose. The oxygen goes to the semi-permeable membrane into the capillaries. Like I said, the semi-permeable membranes would be the walls of the capillaries and walls of the alveoli. The breathing mechanism is pretty much how we breathe. So the diaphragm would help aid the breathing mechanism by, as it pushing up, it'll allow more room in the thoracic cavity with which you are able to fill up with air. So having a stronger diaphragm would mean that you'd be able to bring up more and cause your chest to push out more to bring in the more air. The intercostal muscles would help expand and bring out your chest or your thoracic cavity to cause more room. So pretty much with a strong diaphragm and strong intercostal and intercostal muscles would mean that you're able to bring out your thoracic cavity bigger, so that you're able to bring in more air and exhale with more force. The thoracic cavity is otherwise known as chest cavity, and this would go from the diaphragm up to the clavicle. This has three compartments: the medius sternum, which is where the heart and the trachea is located, and you've got two pleural cavities, which is either side of the medius sternum, which contain the lungs. Most of the thoracic cavity would be taken up by the cardiovascular and the respiratory system. As you can see here, in there would be the thoracic cavity. This would be the top of it where the clavicle is. You got the ribs and the sternum. The intercostal muscles, how pliable they are, would help to determine how big your thoracic cavity is. As the stronger they become, the more pliable they become, which would allow them to move out more, to gain more air in, and contract with more force to breathe the air out. The diaphragm is there to aid your thoracic cavity and help it to expand and to increase the amount of air which you are able to breathe in. When the diaphragm relaxes, it creates more room in the thoracic cavity, but when the diaphragm pushes up, then it pushes the air out of the body with force. As you can see here, you've got the diaphragm which sits under both of the lungs. As you can see, if the diaphragm pushes up, it causes the lungs to push out and cause your rib cage to move out. Whereas if it relaxes, it would make it push in, it will just fall down, and would help your rib cage to go in, and that would be the breathing out phase of the breathing mechanism. Thermoregulation is the way that your body either stays warm or stays cold. As in hot days, your body would help to stay cool by vasodilating the blood vessels. So that means the blood vessels would get wider, and that would release the pressure on the walls and reduce the heat coming from the vessels. Whereas if it was a cold day, that your vessels would vasoconstrict, and that is the narrowing of the blood vessels, which would make more pressure and more friction along the walls, and that would help to warm up the vessels. The body removes waste from the muscles by the capillaries. So once the oxygen goes to the muscles and is used, and the waste product would be carbon dioxide, that would come in the bloodstream, come up the veins, into your capillaries, into your alveoli, which then take out the bronchioles, bronchi, trachea, larynx, pharynx. Then it would send it out through either your nasal cavity or your mouth, and back into the air where it would remain. Right, in the lungs there are 5 lobes. On the right has 3 lobes, the left has 2. On the right they're called the superior lobe, the inferior lobe, and the middle lobe. Whereas on the left you only have the superior lobe and the inferior lobe. Each of the lobes has their own way of collecting air from a secondary bronchi. Each lung also has 18 segments, which the right has 10 and the left has 8. Each segment has its own oxygen and blood supply, so that means if one of the segments are damaged or dies, the rest of your lung doesn't fail as well as that piece. As you can see here, this shows the different segments of which are in the lungs. So each one of them would have their own blood supply. So if number 10 here, it gets damaged or dies, the rest of the 9 on the right hand side would be able to work fine. The lung volume is the amount of air of which the lungs can hold, and this is determined by the tidal volume, of which is the amount of air which the lungs can hold in one breathe in. This can be increased by the more pliable intercostal muscles, so that it's able to create your ribs to bring out more than what it normally would be. And then vital capacity, which is how much you are able to breathe in with one breath in, and the residual volume is the amount of air left in the lungs after maximum exhalation. So they're having the better residual volume means that there's still some more oxygen being pulled around your body, where even after you exhaled all the carbon dioxide which are in your lungs at the moment. The pleural membrane is there to make sure that the lungs stay inflated. So there's each of the side of the lungs has their own pleural membrane. They're not connected, but so that if one becomes deflated by any chance, the other one would stay inflated and working fine. The gap between the parietal pleura and the visceral pleura is made up of a lubricating liquid which allows them to rub together with little friction, and that would help to prevent them from warming up and being worn down as they're rubbing together. As you can see here, you got the visceral pleura, like I was talking about, the gap between the visceral pleura and the parietal pleura. The gap in between, this would be the lubricating liquid. So this would prevent it all from rubbing together and causing any damage to your lungs. The function of the blood is to transport the oxygen and nutrients around the body to the muscles and organs which need it the most. It also helps blood clotting. So if you got cut, then the platelets and proteins in the blood would join together, and it would cover over the cut, and it would create a scab, which is all the dead platelets and stuff. And then as that starts healing over, it start creating new skin cells underneath the scab. I'm going to use Mo Farah again, but to tell you about him and having a good cardiovascular system. He'd have a strong heart after training. It would increase the strength and the size of his heart, and that would help pump the blood through your body with less pumps. So as he's working, him at his state now, his heart wouldn't have to beat as much whilst halfway through the race than what he would have, let's say, when he was 14. And then the capillaries, there'll be more of them, which would help to the gaseous exchange and to get the oxygen into the muscles and back the carbon dioxide out of it. And the amount of alveoli for which the capillaries can wrap around to get the oxygen out. So he'd have a very strong heart and a very efficient gaseous exchange to get the oxygen into the muscles and the carbon dioxide out of